Sam Newhouse, and I will be discussing the effectiveness of wilderness therapy today. I wanted to start by talking about an organization that helps spark what is modern-day wilderness therapy. That organization is Outward Bound, and it was developed kind of precursor by a man named Kurt Hahn in Scotland. And the year was 1943, and Hahn was teaching leadership and character skills to students at the Gordonstown School by kind of taking them out into the wilderness, doing camping trips, so on and so forth, to do that. And then as World War II began, he changed and adapted his program to educate and teach young sailors who were inexperienced in combat valuable skills that would help them fight battles. All the while, Hahn still emphasized that leadership and having a strong character in the program that he used for these soldiers. Modern-day wilderness therapy in the U.S. kind of started in the late 1950s after an adapted Outward Bound program and migrated from Europe over to the U.S. Since its introduction, many different programs focusing on different mental health problems have sprung up into today's wilderness therapy industry. These programs cater mostly to individuals who have mental health problems and behavioral problems, such as like conduct disorder, but they also use for things like family conflict. My question in this presentation is, with all these wilderness therapy programs, it presents the question of like if it actually is effective, if it works. And this presentation will delve into the different ways that we can see evidence of wilderness therapy being effective. We'll also explore how wilderness therapy is ineffective. We'll be looking at this through two examples through previous research, and also by examining in-depth case study on a group of individuals who underwent wilderness therapy. And then finally we can see it by actually examining a successful wilderness therapy program. So how wilderness therapy works, many different programs incorporate the same general practices, but they can vary. Usually a client will approach the program and apply to be a part of it. This is due to programs specializing in different conditions or mental behavioral health problems. The application process usually involves an evaluation of the candidate to see if they would actually have success in the program. Once a participant is accepted, they will undergo a three-phase process including cleansing, which is mostly for drug and alcohol problems and some behavioral disorders such as delinquency, where it removes them from the environment that they would be most tempted to engage in that problem by actually taking them out into the wilderness and removing them from that situation. The second phase is personal and social responsibility, and that encourages the participants to reflect on how their actions affect others. And finally is the transition and aftercare phase. This is at the end where the program actually works with the participant to help get them back into society and prevent their issues from returning in the future. We can look at the Anasazi Foundation in Mesa, Arizona to get a better idea of how wilderness therapy is run. It operates in Arizona forests and wilderness areas, taking participants out of their normal lives and into this program. It began in the 1960s by taking failing college students out into the wilderness to teach them about self-reliance and having a good work ethic. And when it had really good success with that whole idea, it was asked by the courts in Arizona to develop a similar program, but adapted to help troubled youth. They use counselors referred to as shadows to work with both the participant and their parents through the entire program. Due to some of their participants still being in school, they offer small school credit to help keep them on track with missing class time. They emphasize having good physical education, experiential communication, and leadership skills and self-reliance. So about Anasazi's successful program, the average age of their participant is actually 17 years old, and it comes to the program mostly due to having severe family conflict, but they also have participants who have different behavioral or emotional concerns. Anasazi is a program that does have an extensive application process, only to accept the applicants who will have a high chance for success in the program. Anasazi's success rate is actually 83%. There's 17% chance of failure / incompletion, and that's mostly due to a participant having an unforeseen severe psychiatric condition, and that's usually not determined when they're evaluated, but comes up later on in the program. And this program is not designed for that, and it does not have the resources to help with that condition. Moving on, we can look at some works of literature, just some research that's been done on this whole topic. And we can look at Michael Lariviere to find out like the consistency of observational data that was collected on various wilderness therapy operations. In his method of study, they collected data and compared using kappa coefficient and convex alpha. They explained that these two methods are used to find similarity between reports, getting that a score of 1.0 is perfect correspondence between the reports, and 0 is having no correspondence. In their study, they had a convex alpha of 0.12, and this shows that it has little correspondence between each result, between each test score. And Lariviere explains that wilderness therapy programs are used for a number of mental health issues, but more for affective and behavioral problems in the at-risk youth population. Lariviere made some excellent observations when it came to how effective some of these programs can be. The points don't show that the patients are consistent through every study, and they actually have very different results per test. This could be due to the fact that though these individuals may not have similar mental health issues, they don't actually come from the same background as each other. He also discovered that wilderness therapy was very effective for at-risk youth populations, and he explained this by describing that adolescents don't really want to spend time in traditional conventional therapy, sitting in an office, but they would rather be kind of outside and like having the incentive of activities and exploring is really good for them to be effective as well. It seems that, and based on his kind of study and all his information, it seems that targeted populations work better when they have like certain requirements and they're focusing on a certain issue. Next, we can look at Nicole Hill, and she addresses that wilderness therapy as a treatment option for at-risk youth with mental health issues. She starts by mentioning that adolescents encounter more risks and demands that are more complicated now in the 21st century than they did 100 years prior, stating that adolescence is a period of transition, and argues that it can be difficult for some individuals to develop their identity. She also identifies that at-risk youth are more likely to engage in high-risk behaviors such as delinquency, behavioral problems, and emotional problems, which can complicate their ability to develop into healthy adults. She also talks about how the fact that wilderness therapy has a definition of a traditional counseling setting, such as in an office, but it is outdoors and uses adventure-based activities, kind of getting that incentive, more of a, or less of a serious type environment. The way Hill described how wilderness therapy works She looks at it from a standpoint of how it directly fits the needs of the population it generally serves. Her breakdown of why it was designed to serve at-risk adolescents was key in what her paper was explaining. Pointing out why at-risk youth are at risk can put reasons as to why this type of therapy is needed and can be useful. Having an outlet for these adolescents who are at risk to build personal skills that wouldn't be found otherwise is a great argument for why these programs can be effective. However, she finishes her argument by stating that there is no definitive way to provide wilderness therapy for individuals. There's no set guidelines, no set boundaries. It's very free-flowing. This was a key point in allowing for the idea that no one individual is going to respond to a therapy in a certain way. Joanne Bettman actually evaluated wilderness therapy participants in an attempt to find out what the change in behavior associated with wilderness therapy programs is caused by. Bettman explained that the various quantitative data, she gathered a bunch of quantitative data and explained it by giving it a percent. And actually, it reported on the different successes and relapses that occurred throughout different case studies over the years, but it resolved by saying there is need for research to continue to understand what makes these outcomes possible. Evidence was discovered that showed wilderness therapy was successful at reducing symptomology for patients with multiple health issues, and a conclusion was made through a case study that a participant's willingness to change was not needed in order for the wilderness therapy program to be effective. Her case study, Bettman performed a case study on a group of about 189 participants in wilderness therapy, and that was made up of 66% female and 34% male, with the average age of 15, almost 16 years old. The diversity of the group was described as nearly 82% white, non-Hispanic individuals, and the remaining clients were identified as clients of color. Through 32 independent tests, they found that the participants were less motivated to undertake treatments and could have been less motivated to undertake traditional therapy treatments and could have been able to have higher symptoms of behavioral dysfunction. She used the Youth Outcome Questionnaire, or the YOQ, as a dependent variable for gauging the difference from start to finish of the treatment, which lasted 8 weeks. Her case study, a little more on that. The information gathered from the study sample led to the outcome that the participants entered the study within the severe range of presenting issues with a total YOQ score of 74.95. After the therapy was provided for the individuals, the YOQ score actually decreased by 33.45%, and that allowed for discharge YOQ score of an average out of all the participants of 43.14. She had significant findings in their study that presented the evidence that wilderness therapy is effective. They used their tests to find qualitative values for their outcome to show the exact rate of change for a group that undergoes wilderness therapy. However, the problem with this is their data just presents for the group, not each individual. The findings present that the group as a whole had a decrease in their YOQ score, but it leaves it open like, well, what about the individuals in the program? They proved that overall wilderness therapy is effective in general, but they cannot prove that it's effective with every individual in the program. Some of the things that could be issue for wilderness therapy in the future Wilderness therapy programs are effective in the long run with providing intervention for adolescents that have compromised mental health due to various issues. But I don't believe that it is effective for every individual for every situation. Organizations should continue to provide therapy to those who they believe will benefit from the intervention, but not just in general, anybody who signs up, they can have wilderness therapy. There's not enough research on that right now. There's not enough evidence to show that it will work for every individual, but focus groups will have a high success rate. If every institution that provides wilderness therapy started to implement a sort of application process, kind of what Anasazi uses during their admission to the program, it would allow for a lot higher success rate in the individuals applying. Developing research for individuals rather than groups as a whole, groups of participants as a whole, will also provide more insight as to how effective the wilderness therapy process is per individual. This information can be used to create more specified intervention programs to help more individuals or rule out a group of individuals from wilderness therapy programs. Finally, I want to talk, just about done, the research suggests that wilderness therapy is effective for adolescent individuals who suffer from various mental health problems. In general, it is effective. But it leaves room for the question of if wilderness therapy is effective for any individual. Having more research on specified mental health problems can lead to a more accurate answer to the question of if wilderness therapy is effective for adolescents. Thank you.